My name is Payal Somnani, roll number 58. My topic is thyroid and antithyroid drugs. First, we will discuss about thyroid. The hormones secreted by thyroid gland are thyroxine, triiodothyronine, and calcitonin. Calcitonin mainly involved in regulating calcium metabolism. Thyroxine and triiodothyronine is mainly secreted from thyroid follicular cells, which is regulated by thyroid stimulating hormone secreted by anterior pituitary, which in turn is inhibited by free thyroid hormone. The deficiency of thyroid hormone in children results in cretinism, and in adults it results in myxoedema. Hypersecretion of thyroid hormone is known as thyrotoxicosis. Synthesis of thyroid hormone. It involves 5 steps. First one is iodide trapping. Active transport of iodide ions into follicular cells of thyroid gland is known as iodide trapping. This takes place by basement membrane protein called sodium iodide symporter. This process is inhibited by two drugs. First one is thiocyanate and perchlorates, which mainly competes with iodide. Second step is oxidation and iodination. Here, iodide ion is oxidized to iodine by peroxidase enzyme. Then iodine combines with tyrosine residue of thyroglobulin molecule and form monoiodotyrosine and diiodotyrosine. Here, peroxidase enzyme is blocked by high level of iodide and thiourea group of antithyroid drugs. Third step is coupling. Here, two molecules of diiodotyrosine couple to form thyroxine, and one molecule of monoiodotyrosine combines with one molecule of diiodotyrosine to form triiodothyronine. Fourth step is hormone release. Release of thyroid hormone takes place under control of thyroid. Features of hyperthyroidism. In metabolism, it increases BMR. In lipid metabolism, it decreases cholesterol and triglyceride level. In carbohydrate metabolism, it increases glucose plasma level, so causes hyperglycemia. In protein metabolism, it causes negative nitrogen balance and wasting. In cardiovascular system, it increases heart rate, stroke volume, cardiac output with decreased peripheral vascular resistance, and ultimately it causes arrhythmia and angina. In CNS, it causes nervousness and anxiety. In musculoskeletal system, it causes weakness, muscle fatigue, increased deep tendon reflexes, hypercalcemia, and osteoporosis. In GIT, it increases appetite and diarrhea. In hemopoietic stem system, it causes anemia due to increased RBC turnover. In reproductive system, it causes menstrual irregularities and decreased fertility. In eyes and face, it causes lid retraction, periorbital edema, and exophthalmos. In skin and appendages, warmth, moist skin, heat intolerance, fine and thick hair. Features of hypothyroidism. In metabolism, it decreases BMR. In lipid metabolism, causes hypercholesteremia, hypertriglyceridemia. In carbohydrate metabolism, it causes hypoglycemia. In protein metabolism, it causes positive nitrogen balance. In cardiovascular system, it decreases heart rate, stroke volume, cardiac output, ultimately causes pericardial effusion. In CNS, it causes lethargy, mental retardation. In musculoskeletal system, it causes stiffness and muscle fatigue. In GIT, it causes decreased appetite, constipation, and ascites. In hemopoietic stem system, it causes anemia due to decreased RBC production. In reproductive system, it causes menorrhagia, infertility, impotence, oligospermia. In eye and face, causes puffy face, large tongue. In skin and appendages, it causes pale, dry skin, intolerance to cold, brittle hair, and nail. Preparations of thyroid drugs. First one is levothyroxine sodium T4 available in tablets and IV. Liothyronine T3 available in oral tablets. Then the therapeutic use of thyroid drugs. First we will use in cretinism and myxoedema. In cretinism, treatment of newborn should be started as early as possible after the birth to ensure normal growth and cognitive development. Replacement in elderly and patient with coronary artery disease should be treated with low dose of levothyroxine sodium such as 12.5 to 25 microgram daily and slowly increases to prevent precipitation of ischemia and myocardial infarction. In young adults with hypothyroidism, full replacement dose of levothyroxine sodium can be administered 50 to 100 microgram daily as a single dose orally in the morning on the empty stomach. The goal of the therapy is to relieve symptom and restore serum thyroid stimulating hormone to normal level, and treatment is for lifetime. Secondly, it is used in myxoedema coma. It is a medical emergency condition. It usually common in long-standing untreated myxoedema cases. It is usually precipitated by infections or other forms of stress. Their diagnosis is clinical features like hypothermia, bradycardia, pleural effusion, pericardial effusion with coma, history of previous thyroid surgery or replacement therapy with poor complaint. Estimation of plasma level of T3, T4 and TSH. Treatment should be started based on clinical features without waiting for confirmation. Treatment: levothyroxine intravenously if available, otherwise via nasogastric tube. So, some prefer to use liothyronine with initial dose of levothyroxine. Second one is intravenous hydrocortisone. Third one is rewarming with blankets. Fourth one is correction of electrolyte imbalance. Fifth one is ventilatory support may be required. Sixth one is antibiotics if the infection is the precipitating cause. Third, it is used in benign thyroid nodule. In some cases, therapy with T4 suppresses TSH level. Fourth, it is used in thyroid carcinoma. Thyroid hormone suppression therapy is used in papillary carcinoma of thyroid to suppress TSH and prevents its stimulation of growth of the tumor. Second topic is antithyroid drugs. These drugs reduces the level of thyroid hormone by reducing thyroid hormone synthesis or release or both. They are used in treatment of hyperthyroid conditions, thyrotoxicosis. Classification of antithyroid drugs. First one is thyroid hormone synthesis inhibitor. It includes propyl, thiouracil, methimazole, carbimazole. Second one is inhibitors of iodide trapping, also known as anion inhibitors. It includes thiocyanate perchlorates. Third one is hormone release inhibitors, iodide of sodium and potassium, organic iodides. Fourth one is thyroid tissue destroying agent. It includes radioactive iodine 131. Others propanolol, atenolol, diltiazem, and dexamethasone. Thioamides are also known as thiourea derivatives. It includes propyl thiouracil, methimazole, carbimazole. They are the thioamides used to treat hyperthyroidism. Mechanism of action of thioamides are they inhibit thyroid peroxidase enzyme which converts iodide to iodine. They also inhibit iodination of tyrosine residue in thyroglobulin. They also inhibit coupling of iodotyrosenes. Pharmacokinetics of thioamides. Thioamides are well absorbed orally. Propyl thiouracil is most rapidly absorbed. Carbimazole is converted to methimazole after absorption. They are widely distributed but get accumulated in thyroid gland. Propyl thiouracil has a short half-life, needs to be given every 6 to 8 hours. They are excreted in urine. They crosses placental barrier and can cause fetal hypothyroidism. Both propylthiouracil methimazole are safe for use in pregnancy. Propylthiouracil is preferred to methimazole for treatment of hyperthyroidism during first trimester of pregnancy. Adverse effects of thioamides. Skin rashes are the most common. Other side effects are joint pain, fever, hepatitis, and nephritis. And rare adverse effect is agranulocytosis, which usually occurs during first few weeks or months of therapy but may occur later also. In these cases, drugs should be stopped at the first sign of agranulocytosis, that is, sore throat or fever. Hepatotoxicity can occur rarely with thioamides. Uses of thioamides for long-term treatment of thyrotoxicosis where surgery is not indicated or not feasible and radioactive iodine is contraindicated. In these cases, carbimazole or methimazole is preferred for long-term treatment as it is long-acting and has fewer side effects than propylthiouracil. Second uses for treatment of thyrotoxic crisis, propylthiouracil is used along with iodide and propranolol. And third uses preoperatively in thyrotoxic patient before subtotal thyroidectomy, carbimazole is used to achieve euthyroidism. Anion inhibitors. It includes thiocyanates, perchlorates, and other anions block uptake of iodide by thyroid but are highly toxic and have unpredictable effects. For these reasons, they are not used clinically. Hormone release inhibitor drugs. It includes iodine, iodides of sodium and potassium. Iodides are the oldest agent used to treat hyperthyroidism. They are the most rapidly acting antithyroid drugs. Although exact mechanism of action is not completely explained, high concentration of iodide appears to inhibit almost all the steps in the synthesis of thyroid hormone and also their release. High level of intracellular iodide inhibits organification of iodine, which is transient. Thyroid scape occurs after 2 to 8 weeks. Preparations and uses. Leucol iodine, it consists of 5% iodine in 10% solution of potassium iodide. It is used before thyroidectomy and in thyroid storm. Second one is ipodate sodium and iopanoic acid. They are also used in before thyroidectomy and in thyroid storm because they rendered gland firm, less vascular, and decrease its size, which makes surgery convenient with less bleeding and complication. Third, it is used as an antiseptic. It includes tincture of iodine. Fourth, it is used as prophylaxis of endemic goiter. Iodinized salt is used. Adverse effects of iodine and iodides. It includes allergic reactions like angioedema, laryngeal edema, arthralgia, fever, eosinophilia, lymphadenopathy. Chronic overdose with iodide results iodism. The symptoms include headache, sneezing, irritation of eye with swelling of eyelids. Sometimes pulmonary edema can occur and sometimes hypothyroidism may also occur. These resolve after few days of stopping iodine. Use of iodides during pregnancy may cause fetal goiter. Other drugs like radioactive iodine, they are the thyroid tissue destroying agents. Therapeutically used radioactive iodine is 131 iodine. Sodium iodide 123 iodide is used for diagnostic scan. It get concentrated in same way as stable iodine in thyroid and emits gamma and beta particles. These beta particles can cause destruction of follicular cells leading to fibrosis and correction of hyperthyroid state. Preparations of radioactive iodine. Iodine 131 is used orally as a solution or capsule. The dose is expressed in microcurie. Use and contraindications of radioactive iodine. Radioactive iodine is used in hyperthyroidism due to adenoma, carcinoma when surgery is not feasible or contraindicated. It is contraindicated in pregnancy, children, and nursing mothers. Advantages of radioactive iodine. Treatment is simple, does not require hospitalization. Second one is low cost. Third one is no risk of surgery and scar. Fourth one is permanent cures hyperthyroidism. Disadvantage of radioactive iodine. It is slow acting and cause local soreness in the neck. Incidences of hypothyroidism is high. It is not suitable for pregnant women, children, and young patients. Other drugs, beta adreno receptor blocker or beta blocker. It includes propranolol, atenolol, metoprolol can be used. They produce dramatic improvement in symptoms of thyrotoxicosis like tachycardia, palpitation, tremors. Propranolol also has an inhibitory effect on peripheral conversion of T4 to T3. Use of beta blockers. First, to control symptoms of thyrotoxicosis initially till antithyroid drugs X. Second, in thyrotoxic crisis. In third, preoperatively before thyroid surgery. What is thyrotoxic crisis or thyroid storm? This is the manifestation of severe hypermetabolic state due to which high level of circulating thyroid hormone. Besides the usual features of hyperthyroidism, this is characterized by hyperpyrexia, cardiac arrhythmia or atrial fibrillation, nausea, vomiting, diarrhea, mental confusion. It is usually precipitated by infections, trauma, surgery, diabetic ketoacidosis, myocardial infarction. Treatment of thyrotoxic crisis or thyroid storm is hospitalization. Supportive care includes cooling blankets, hydration, sedation, and antibiotics to treat infection. Third one is propylthiouracil is administered via nasogastric tube. Fourth one is oral iodides to inhibit release of thyroid hormone. Second, sodium iodate inhibits its peripheral conversion of T4 to T3. Fifth one, propranolol orally or intravenously. Diltiazem can be used if propranolol is contraindicated. Sixth one, intravenous hydrocortisone. It inhibits peripheral conversion of T4 to T3 and also corrects adrenal insufficiency if present.